first and foremost, we're focused on the patient and how patients feel, how their families feel within the facility from an environmental standpoint, but also making sure that operationally their care is provided in the most efficient, effective way possible. Specifically for a neurological patient, because there's a higher percentage of patients that have fairly severe cognitive, sensory, mobility issues, we're just very careful to be sure that we're reducing the amount of confusion in the environment, that we're providing clear means of maneuvering within the facility. I think one of the great things about this institute is it is a comprehensive neuroscience center, and all of the diagnostic and treatment spaces are condensed within one building. So patients and their families don't have to traverse a campus or even between campuses to get the type of neurological treatment that they would need. So it's actually, I think, one of the few comprehensive neuro institutes in the United States. On the ground floor, we have a monumental stair that is an open stair that connects the ground floor where the diagnostic spaces are to the first floor where the clinic spaces. And because that's below grade, we want to have as much natural light spilling into that public space as we can. So we've carved out a light garden along one of the facades of the building next to McConnell to provide an opportunity for views from that lower level and to get natural light from that lower level. We are very conscious of providing as much view opportunities from the patient rooms as possible. So we have floor-to-ceiling, wall-to-wall glass, instead of what often is just a punched opening and a view port. We actually have a view wall for the patients and the families. And it's also an amenity for the caregivers. And it allows light to spill into the corridor, so we're not always dependent on just artificial lighting to light up those interior spaces of the inpatient unit. So the views are also echoed on the inboard side of rooms that actually look into a courtyard. So we've provided a courtyard that is, I think, the equivalent of 4 tennis courts in size for the full height of the patient unit, and the roof level of that courtyard is a green roof. But for me personally, probably the proudest moment was we were waiting for the board to come to the final approval board meeting for the project, and had staged outside of the vestibule, the pre-function area of the boardroom, models and renderings and the like. And we're showing some of the board members some of the features of the design and answering questions. And at one point, I overheard Dave Blum, CEO of OhioHealth, very proudly talk about the exterior of the building and how well it integrates into, but doesn't mirror identically, the buildings on campus. And I heard him use words that we would use as architects to describe some of the features. So that's something that's going to stick in my mind for the rest of my career, because I felt as though we were doing the right thing.